True.
No. Well, here in Eastern Idaho, the staff and students at Idaho State University are curious about the sleep habits of our local kids.
That's right. So Dr. Maria Wong is a professor of developmental psychology at ISU and has done extensive research on the effects of poor sleeping habits in children. Dr. Wong, thank you so much for joining us today.
Glad to be here.
It is really important that kids get good sleep. And from what I understand, the effects even go into adulthood if they don't get enough sleep when they're kids.
Right, and what we find is that sleep affects a whole variety of behaviors, including cognitive performance, interpersonal behavior, as well as substance use.
Really?
Ah.
So when you're conducting a sleep study, what are some of the things you're looking for, and how are some of these tests conducted?
Well, there are a variety of ways. We ask the parents how well their kids sleep. We also talk to their kids and we have them keep a diary.
Okay.
And we are currently doing 2 additional things, getting some objective data about how well they sleep. So for example, we give them a watch to wear, and it's called an actigraph watch. Okay. So what it does is it will record their activity throughout the day and the amount of lights that they're exposed to during the day and at night. Okay. And the actigraph watch would allow us to figure out the quality and the quantity of sleep at night. Because a lot of the times parents don't even know how well their kids sleep because kids are oftentimes in their bedroom alone, you know, doing this, playing video games. Another way that we're trying to do recently is to have children going into the Port Neuf Medical Center. They have a clinical sleep lab there. So we'll be able to look at the brain waves of children who actually sleep, in order to figure out how well they sleep, whether they have what we call rapid eye movement sleep, how deep is the sleep, and things like that.
Now you're about to start 2 different studies having to do with sleep and children. You're looking for candidates. What kind of candidates are you looking for? Do you want people who don't sleep well, or just kind of the average sleeper?
We welcome all children. Basically, the criteria is, there are 2 studies. One studies look at sleep and health, and we're looking for children who are between the age of 8 to 12. So basically, any children between the age of 8 and 12 would be eligible. And we ask them to come in and do a screening. We pay for their time for the screening. If they meet the criteria, they will be able to participate in the study. Another study that we just started, we try to recruit children from between the age of 8 to 11. And we do not have any requirement for that study other than the fact that their parents are willing to let their kids participate. One is a more long-term study, and the other is a short-term study.
Now, when it comes to kids and sleep, what should we be shooting for as parents? What's a good number for children to get?
Well, according to the National Sleep Foundation, if you have a school-age child and they are going to school the next morning, it's best to keep a routine. And the recommendation is that they sleep at least 10 to 11 hours, especially when they're going through a growth spurt. A lot of school-age children don't get that because parents think that as their children get older, they don't need as much sleep. When in fact, because the brain is rapidly developing at that time, it kind of needs that resting time.
So even teenagers need to get that amount of sleep as well.
There's a lot of individual differences. Some kids may need less than 10 hours or less than 11 hours. Some kids may need more. But that's most experts would agree that that's an optimal amount of sleep is between 10 to 11.
And this 10 to 11 hours sleep, is it all at one time at home, or can they sleep in class at school?
That's at bedtime, at nighttime.
That's a bedtime.
Very good.
Well, thank you so much. We'll have the information. If people want to get involved in this study, we'll have it on our website that people can contact you. Thank you so much for coming in today.
Thank you.